Good morning to everyone. I'm Dr. Reshma, a consultant dermatologist at Calon Skincare Clinic, Bangalore. Today I'll be talking about myths and facts about psoriasis. Psoriasis is a multi-system disorder which most commonly affects the skin, the nails as well as the joint. When it affects the joints, it is known as psoriatic arthritis. Psoriasis is also known to affect other organ systems as well. So therefore it is a multi-system disorder. It is characterized mostly by red patches which are present on the skin, and those patches when you scratch produce white silvery like scales. And psoriasis is associated with various myths and facts as well as it creates a social stigma. To get rid of those social stigma, I'll be telling you about the myths and facts which is associated with psoriasis. The first most common myth which is associated with psoriasis is that psoriasis is a contagious disease. But in fact, psoriasis is not contagious. It doesn't spread from person to person by direct contact or by having food together or sitting next to each other. Psoriasis is actually a multifactorial disease which has a genetic component as well as associated with certain dietary changes, stress factors, but it is not a contagious disease. Coming to the second myth, psoriasis appears to occur in people who have pure hygienic practices, but in factual there is no such thing which is related to the hygiene. Presence of psoriasis does not indicate that the person has poor hygiene. The third myth which is associated with this condition is that sun exposure increases the disease, but that is a myth. The actual fact is that a small amount of sun exposure actually helps in reducing the amount of diseases. Even in some patients, we even go for phototherapy wherein the patient is exposed to ultraviolet light, and that is actually going to bring down the severity of the disease. The fourth myth is that the psoriasis is transmitted from the mother to the child as well as it affects fertility in the pregnant women, but that is not true. Psoriasis does not affect fertility in women and it is not transmitted from the mother to the child if the mother develops psoriasis during pregnancy. And the final myth I want to talk about is that many people feel that hot water baths, and if they keep on removing the scales by scrubbing their body, the psoriatic disease is going to reduce. But it is not true. The fact is that hot water is going to dry up the skin and the scratching is going to destroy the epidermis of the skin, which is going to flare up psoriasis, as well as the drying up of the skin will also result in more inflammation and more psoriasis. So hot water bath and scrubbing of your skin will not help you in reducing the psoriatic disease. Thank you so much.